And just wanted to take a moment as maybe you can respond in the chat. What brought you here today? Was it concerns about your own driving or others as we all age? Are you looking to make adjustments to continue driving as long as possible and safe? Or are you here today because you're concerned about someone you love that needs to modify or stop driving? Or you're wondering how you can have that conversation with the older adult in your life. So things to keep in mind, there is no age limit to driving. Now we have, in most states, the earliest age you can start driving legally is 16 or 17, but there is no end date. And once somebody's driving, it can be a difficult thing to change or give up. So it's an emotional experience and often involves a lot of grief and depression as we adjust to changing or stopping driving. Often people can consider it a personal admission that they have less ability. It can be a challenge to being independent and being autonomous, which is so prominent in our society. And it's going to mean some practical changes need to be made. There's nothing that is an equal substitute to driving your own car. And keeping in mind, even if it's not you that you're concerned about right now, that all of us, including myself, will likely need to make driving changes as we grow older. And I know for myself, I'll probably go kicking and screaming. So driving in the USA, it's a symbol of independence. You know, I used to live outside of Detroit. It's such a big part of our culture. It can be a symbol of control, responsibility, adulthood. It can be a status symbol. Sometimes people get cars that reflect the image they like to convey about who they are. And we are driving longer than we've ever been in the past. So 82% of men and 55% of women over 70 are still driving. So that means of all licensed drivers, there are more than 20% on the road now, or 51 million drivers who are over 65 as of 2021. I don't know if any of you hear my dog is scratching at the door. Just ignore him if you can hear him. So why do we drive? So it helps keep us connected socially. It can help us with getting to work and shopping, getting to medical appointments, which becomes a bigger issue as we get older. It can help keep us active, take us to fun events, get errands done. Excuse me 1 second. I'm just going to text my husband to let my dog out. Sorry about that. And transportation is a huge issue for older adults that can't drive. It's let's face it, the alternatives, they're not as desirable, they're not as flexible. And it's a hard substitute to just getting in your car and going whenever you want. We have most of our communities were not built for walking or getting to places. They're, especially the suburbs, were very much built around the driver. However, this is changing a lot. We're having more communities that are built for walkability. So driving, when we've done it for a while, it becomes a habit. So how many of us have had the experience of we are in a car, driving along, and we get to the destination, we have no idea how we got there. It can become really automatic, and so much so that we consider it our free time. So we might do other things, listen to podcasts or audiobooks or music, or texting. We might get very distracted by our phones. I've actually seen people watching movies as they're driving, or trying to read the paper. But what's going on under the surface is a lot of cognitive load. So it's estimated we make about 20 decisions per mile, with often less than a half a second, where if we don't make those decisions, we might get into a collision. So we might not be aware of it, but we're never really fully on autopilot. And driving's complex. So there's an ongoing need to pay attention to a lot of different stimuli at any given time. So you might have cars all in all different lanes you're paying attention to, visual, just your visual load. You need to keep an ear out for sirens, for honks, and other warnings. There's a lot that's sensory, a lot of touching, levers, buttons, pushing the pedals. And we need to prioritize what to do in a moment and make a snap decision. So like, do we hit that pothole or do we move over to the other lane to avoid it? Or are we going, is there a car coming there where we need to go over the pothole and we need to slow down right away? So lots of snap decisions are essential. And we're doing a lot of guessing and anticipating what other drivers are going to do. And we have to practice defensive driving. At any given time, we're having to recall a number of steps to get to a destination. So we're pulling together which turns to make, how are we going to get there, having to be adaptive as things change. We need to have quick reflexes. And we need to be able to deal with the unexpected. So there might be roads that are closed or weather conditions or a power outage. And we need to be adaptable as those things happen. And we're constantly comparing what's happened in the past, and that's showing up with how we respond in the present. So if you've ever had the experience where you have a near miss, you've almost hit the car in front of you, you might, at least for a period of time, leave a little more distance between the car and the car in front of you. And the good and the bad on driving. Well, the good is new cars, they have a lot more safety features. So they can tell you if you're drifting off into the other lane, they can actually hit the brakes if you're getting too close to the car in front of you, or tell you if somebody's in your blind spot. Lots of different safety features. And the autonomous vehicles, this could be, depending on your perspective, could be good or bad, but they're on the horizon. So even as we're doing this, they're testing out autonomous cabs, and I think it's Austin and San Francisco. So that probably in our lifetime will become much more prevalent. And there's a decrease in crashes that cause injury. So even and even a decrease in crashes in the last year over an uptick the years before. But even when there are crashes, they're less injurious to people. So the bad of driving. So distractibility, just human error and inattention, that's the reason for most car crashes. And with older adults, people 65 and older are killed at higher rates than younger adults in car crashes. So in 2022, that number was 9,547 people over 65 died when in a car crash. And older adults who stop driving do report higher rates of depression. And more limits to their lives. And according to the AAA, most older adults will outlive their ability to drive safely by 7 to 10 years. So that really struck me when I was doing the research. It's really imperative for all of us to consider that there is more likely than not going to be a time in our lives that we need to plan for driving retirement, just like we do with our employment. And it's Maryland and actually also DC, we're self-reporting states. So nobody's coming after us to say you can't drive. We don't really proactively and doing assessments. It's all self-report. So if you have certain conditions, if you're a licensed driver, you're required to report them to motor vehicles. So what are some common issues that impact safety for older adults? Well, the age of the car, which for older adults, they do tend to have older cars. They don't have as many safety features. They can be less reliable. And having uncorrected sensory limitations. So it's not just having changes to your vision, which is normal aging. We're going to lose some vision, especially with night driving, but it's if it can't be corrected or if you're not wearing glasses that are prescribed. Same with hearing. There might be hearing loss, but maybe can be corrected with hearing aids. But if you're not wearing them or you don't have them, then that can be a safety issue. And changes to tactile sensations. So neuropathy can be a very common condition that can impact your ability, your fine motor, and also your ability to put weight on the pedals. As we get older, our mobility is more impaired, and that can impact our ability to get in and out of the car safely, to drive safely. There might be impaired executive functioning. And so even if it's not a dementia, just changes as we age and planning, our attention, how we perceive depth, and how we organize information can change. Most seniors are on medications, often multiple medications, and they may have some side effects. So even if they're temporary for a period of time each day, drowsiness or brain fog might contribute to driving safety issues. So memory, especially when it's new information, can impact safety. And having a difficulty prioritizing or splitting your attention. So like I was saying before, having to make that snap decision of which danger to choose, that can become more difficult as we age. And we have a harder time doing more than one thing. Multitasking is not good at any age, but it gets even more difficult as we get older. And our processing slows down, so reflexes might not be as fast, and that can impact our driving. Again, especially with putting your foot on the gas or brake pedal. We become stiffer, and that can affect how we're driving. And again, even just getting to our destination and safely getting in and out of the car. And then there might be more variability. So conditions like insomnia or sleep apnea or medications might make it more variable and unpredictable on times that we are safe to drive. So here are some things that make people nervous about driving in general, and then we'll see how they measure up against the facts. So making left-hand turns can be a little bit nerve-wracking. I live on a corner where I've seen so many accidents, probably 80 to 90% caused by people making left-hand turns. Roundabouts can be very scary. I'm personally very nervous around Chevy Chase Circle and have seen a lot of accidents there. Driving next to big trucks can be a source of worry for people. Driving at night or in stormy weather, figuring out who has the right of way, like at a four-way stop, and backing up, especially for long distances or into a crowded parking lot when passing other cars can be an area where folks get nervous. Other aggressive drivers, I think most of us get a little bit nervous when we see the people weaving in and out or driving really fast. Driving alongside motorcycles or bikes or scooters, in the last couple of years, the Uber Eats and food delivery scooters weaving in and out has been much more prominent and a little bit nerve-wracking. So how does that measure up against the facts? So the top crash types for older adults are turning left into an intersection when there's not a stop sign, or turning left at an intersection on a green light without a dedicated turn arrow, which is my neighborhood. Turning right at a yield sign to merge with traffic when traveling high speeds, and then merging onto a highway from a ramp. And there's certain places on the Beltway that are especially nerve-wracking when merging. That is another top crash for older adults. And then changing lanes on a road that has 4 or more lanes. And again, that's a lot of the Beltway here. So older adults often will take precautions without anyone talking with them. So it's not uncommon that older adults just stop driving at night, or maybe they go around the block to avoid a left-hand turn. I'm from New Jersey. We call those jug handles. They might stop driving when it's rush hour, there's heavy traffic, or there's bad weather. And they might just start limiting their driving to closer to where they live. And the fact is, the further away you drive from home, the more increased risk of an accident you have. So many of us want to maintain our driving health and safety as long as possible. So what's within our control that we can do to help us continue to drive as we age? Well, same as overall health, maintaining your physical health with healthy habits, checks on your vision, on your hearing, a healthy diet, exercise, and especially sleep, getting regular checkups, and dealing with whatever health issues as they arise. That is all related to overall driving health. And making modifications to your driving to reduce your risks as you go. So really reflecting on what are your risks and being willing to make those modifications and adaptations. So reflecting on yourself, and part of that might be asking others, what do they think about your driving safety? People are reluctant to bring this up, but if you can give them permission to say, hey, what do you think? What are some red flags that I should look out for with my driving? What have you noticed with my driving? Or if it's a medical provider, is my vision really okay to drive right now? When will it not be? Noticing for yourself, have you gotten a lot of tickets? Have you gotten lost? Have you had any fender benders or near misses? And maybe jotting those down over time to see if you're noticing a trend. Bringing it up with other providers, including your eye doctor, just opening up the question, hey, should I be driving now? And see what they say. Being able to make changes for yourself. So maybe it's limiting distractions, putting your phone away, turning off the radio, driving slower, but not too slow, and allowing yourself more time to get to a destination, and using more caution when you're in higher risk situations. So maybe like if you're in a lot of traffic, or if there's a storm, maybe at those times limiting more distractions, like turning off the radio. So AARP put together a list of the signs that a driver is unsafe and should make some changes or stop driving. And we've talked about some of them: the close calls, finding dents. Sometimes other people will find dents or scrapes on a car, or fences, or unexplained things with the car. I remember this was a big one with my grandmother when she started to have trouble with driving. She just had all these strange dents that just appeared on the car. So getting lost, especially if it's in a familiar place. having trouble following traffic signals or road signs, and responding more slowly, or a little more trouble moving your foot back and forth from gas to brake, or confusing them. Misjudging traffic and gaps in traffic, and making it more difficult to yield or make turns. Being not to blame the victim, but being the recipient of road rage more often, or causing other drivers to honk at you or complain about you or pass you. Becoming easily distracted, and having difficulty concentrating. This can be also another warning sign. Maybe somebody who used to be able to listen to the radio must have it off to fully concentrate on driving. Having a hard time turning your neck around to see and looking in your rear view mirror while backing up or changing lanes. And receiving multiple traffic tickets over time. And if you're somebody that's looking for, or you're noticing some concerns about a driver, here's some things to look for. And this list is from a really helpful document that I've linked to in the notes that can be used with loved ones. But just going through again, are they confusing the gas and brakes? Are they weaving or between straddling the lanes? Do they, like when they look back, do they turn the wheel into the other lane? Does the driver seem to ignore or miss stops or other traffic signals? And we're not talking about 1 or 2 times here. We're talking about this as becoming more frequent. Do other drivers honk at them or start passing them, even if the traffic stream's moving relatively slow? Again, getting lost. And this is a big one for, especially for married couples. Does the driver need to use a co-pilot to help respond to situations? You see a lot of times married couples, they become like one driver, and that co-pilot is doing a lot of looking out for safety issues. And then does the driver drive too slow or too fast? Like, are they driving 50 and a 30 and it's pouring outside? Those are things to look out for. So when is it time to make adjustments and when is it time to really stop driving? Well, if they're just waiting too long to make a turn, or it's very infrequent that they hit a curb, or they forget a blinker from time to time, or they get really nervous or lost when they go to new places they haven't been before, maybe making some adjustments will be all that they need to do at that moment. However, if they even once confuse the brakes and the gas, or if they have impaired consciousness for an alertness for any reason, or they get lost when they're going home or other familiar places, or if they are feeling overwhelmed or confused and they just make a stop in the middle of the road without going over to the side or another smaller road. Or this seems obvious, but if they can't see the road or other cars well enough, then those are times where they should immediately stop driving. And I went to a training many years ago from the Maryland Motor Vehicle or Department of Transportation. They talked about the 5 A's of older driver safety. So considering age, it's not a destiny, but it is a factor in driving. Ability, which is really the key issue here, but how do we really know what one's ability is to drive? Assessment. So assessing yourself and not hesitating to ask other providers for an objective evaluation. How is my driving? And that being part of what you're doing on an ongoing basis. Adjustment, being able to make changes. Maybe it's to the vehicle, and that or maybe it's to the person or to their driving habits or the environment that they're driving in or living in. And then alternatives to driving on your own and trying them out early and often, not just after they have a problem with driving safety. So shifting gears. So now we're going to talk about you have a loved one, you're concerned about their driving. So why do we avoid having those conversations? And the majority of us do, including medical providers. Well, we don't know how they're going to react. It usually isn't a great first reaction. We don't know if our own lives might be impacted if the older adult gives up driving. Will that then put us in a position where we need to drive them around more? And what will that do to our lives? We don't know if we can have a conversation and there will actually be effective change to make them safer. And there might be uncertainty. We might think that there's a problem with driving, but we don't really know. We don't have objective data. And we all live busy lives. We might just not find the time to have the conversation. Or we might not know what to say or when to say it. And in many cases, these are people we love and have a lot of respect for, and we don't want to cause them distress. We don't want to challenge their authority or their autonomy. But we got to work through that. And just know it is tough to talk about. And it might become a conversation about something much bigger than driving, about the person's mortality, about how they live their lives and what control they have. So it's best, if possible, to talk long before there's a problem or after there's a major incident or life change. So we don't want to choose a big family event or a large gathering or right in the midst of a crisis to start having these conversations. We want to really choose our timing well and respect that this is going to be difficult and give the time that the person needs to process. We want to maintain a positive, optimistic attitude, or at least learn to fake it. And acknowledge that the person's going to have some difficult feelings. And part of that is trying to limit our own worry because worry can really be contagious and just increase the level of anxiety in the conversation. And we really want to focus on the goal of driver safety here. And we want to review and maybe provide research about what are some common risks and really make this as much about a safety issue as we can. So when you're having these conversations, no, this person's probably thought about changing their driving habits themselves. So an AARP study showed that 6 in 10 drivers over the age of 50 are worried about their driving future. What's going to happen when they can't drive like they can now? And the majority of drivers report a willingness to discuss it and to talk about alternatives if it's brought up by a family member or a healthcare provider. So one idea that AARP suggests is having an advance directive for driving, just like you would for healthcare. And this can be a way to have a conversation and also document what the person will do in the event of driving safety issues. So when you have the conversation, it's good to have a plan. This is going to be difficult, and it's not just one conversation, but consider it one of many conversations. And talk about what are the alternatives. So in our area, we're pretty fortunate. We have subsidized buses, we have metro access, we have subsidized taxi services. And when we're having a conversation, it is just that. It's not a lecture. So listen to how the person feels, be respectful, acknowledge the feelings. And then again, plan this conversation or these conversations earlier and try and pick your time strategically. You could ask them to assess how do they feel their driving is and what do they see as their strengths or things that are a little more difficult for them. And you could talk about ways that you could take driving precautions. So in the event that they can actually just modify their driving, make it known to them that it's not an all or nothing proposition, and that maybe there are some changes that could be made to keep them driving longer. And you can always encourage the older adult to get an evaluation if there are formal driving rehab evaluators, or maybe it's just if they're in PT or OT, talking with them or other providers. And this is typically a process that involves some time between contemplating giving up driving and then actually making adjustments or stopping driving. So there's probably going to be multiple conversations, sometimes over years. And see, is there a way you can gain consensus on giving up driving when it's unsafe? And sometimes that's in how you have that conversation to solicit from the older adult. What do they feel would be an unsafe situation to stop driving? And it does matter who's the messenger of the conversation and when are you having the conversation. Those can be really key factors. And is this going to be a successful conversation or not? And again, involving other medical providers or others that might be able to have that conversation in a way that there's some more back and forth and defenses are down. And it is important not to overreact to driving safety issues, but also not to underreact. So it could be that, we tend to downplay safety issues because it means such a dramatic change for the person. But again, it's important to push through that. And consider a mix of casual conversations and more serious conversations, and know in advance what kind of conversation are you having. So with a casual conversation, you're not expecting any behavior change. No actions are needed. You're just eliciting information, showing empathy, being informative, inquiring, asking questions. A serious conversation is when you want the person to stop or make a change right away. And that often is after there's an event, not during the crisis, but immediately or shortly thereafter. Say if there's an accident or a medical issue or a medication change. So when you're having the conversation, consider what is your relationship with the driver. So are you the adult child, or are you the spouse? Are you a friend, provider, or other? And that relationship can inform how that conversation goes. So often it is the adult child that brings up these safety issues, but perhaps the spouse, especially the one that's a co-pilot, might be a better match for those conversations to lead to behavior change. And what do you want to accomplish out of this conversation? Sometimes it's just moving the ball forward on the field versus making a significant change right away, and keep your expectations low. Do you know in advance of a conversation how the person drives? Do you have the objective data? The person might get very defensive to say, I've never had a ticket. I'm always been a great driver, never an accident. Well, what are the objective facts? Because it can't be just their age. So sometimes that means driving with the person or having other objective factual data to bring to the conversation. And do you have a way you can communicate that you care about them, what's important to them, and incorporating that into these conversations? Considering the mode of communication, is this maybe more effective in an email or a letter, or is it one-on-one in person or by phone or in a text? So knowing the person as you do, think about what's the best mode for this. And Do you know, has the person already made any changes to their driving? Because it can be easier to build on any changes they've already made and to explore the reasons why they made those changes. And role playing the conversation beforehand or practicing and keeping it brief. That can be very helpful. So when you're having these conversations, be sure to discuss plans on how to get to places instead of driving and have those be flexible plans, something that's reliable and maybe multiple ways to go about it. You don't want to just take something away and not have alternatives to continue to live their lives and maintain a good quality of life. Discussing the short-term and long-term financial trade-offs. So a lot of times we look at the short-term costs, say of ride share or cabs, and we don't really know the total cost of how expensive it is to drive our car. We don't usually add up insurance, gas, maintenance of the car, the risks. So maybe even doing that on paper so you can compare those costs. And not taking it personally. It's not unusual that first response might be very defensive. And it's not about the messenger, it is about the message. But try to keep old hurts from entering the conversations. It usually detracts from the goal. And just get back to focusing on how you're showing support and empathy while you're also moving towards making safe changes. And if a messenger can't be found, perhaps it is best to go to the medical providers or motor vehicles to be the person that encourages change. So some conversation starters, and a lot of this I got from a great module that they do on AARP. So for any members of AARP, you can sign on for free, where they have actors that play this all out. So just some thoughts about conversation starters. So, hey, I've noticed that you're taking a longer time making right turns when the cars are coming. Have you noticed that? Hey, you've always said it's better to be safe than sorry, and I'm concerned that these things aren't safe. So I know you'd feel awful if someone was hurt when you're driving, so that's why I bring it up. Hey, you've had this stroke and I care about you and I know how important your independence is and I respect that. So what are your thoughts now about driving now that this has happened? Hey, I just heard this story on the radio about somebody who confused the gas and the brakes and ran into a crowd of people, and it was horrific. And then just wait for comment. So how would you get to your doctor's appointment if your car broke down or you couldn't drive? Hey, it's hard for me right now to be the messenger, but I care about you so much and I didn't want this to come from a stranger who doesn't care about you. Hey, I get you're angry. I'd probably be too. And then just stop talking for a moment, take a break, maybe even come back to the conversation after a few breaths, leaving the room. Are there some changes that can help you stay safe while you're driving? Do you want some information that's worked for other people in this situation? Hey, would you be willing to try using Uber to get to this doctor's appointment so we can test it out and see how it goes? How was Grandpa when he started to have trouble driving? How did he adjust? I was nervous bringing this up and I really appreciate you talking about it. So when you made that change with driving, when you stopped driving at night, how did that go for you? What went well, what didn't go so well, and how is that for you now? So those are just some thoughts about how to have the conversations, language to use. So generally, older adults, as all of us, do better when we don't have to make a permanent decision to stop driving. So sometimes people's behaviors change, but their language is still that they're drivers. You don't have to focus on their language if the behaviors change. So I've had a number of people I've worked with who haven't driven in years, but they still call themselves a driver. So let that just be. It's not critical. Sometimes people just, that role and that way to convey themselves with the world, it works for them. And sometimes it is necessary to remove a car from someone because the safety risk is just too high and the person just won't stop driving. And know that that sometimes happens. It's not your fault. You can only do what's within your control of having the conversations and potentially reporting. But know that that can be a rough time in a relationship, but that generally people move through that time, maintain their relationships, and that I've seen it with myself being the person that's had the conversations or just observing it as a care manager. For the most part, people move on and they adjust to not driving or changing their driving and whatever hurt feelings there were in that process. So if you're concerned, start with the driver, bring up the concerns. You can always ask the doctor to write a prescription saying no driving. Find ways that you could remove the car that might be more positive, like giving the car to a grandchild or a charity. So making it more of being of service to another person or a charity that's important to them versus just losing something. You could just use what we call therapeutic fibbing. So sending the car out for repairs, disabling the battery, saying that the car is broken down, and then or moving the car to different places where the person doesn't have ready access to it. You can ask the doctor to report to motor vehicles. Doctors' reports are given more credence than reports from loved ones or the general public. And you can offer support with other transportation options, whether it's you giving a ride or sharing other options for how people can get around. And remember, driving is a privilege. It's not a right. And it is something that we need to be mindful of as citizens. So in Virginia, after age 80, you have to renew your license in person. If your license expires, you might need to take a vision or driving or written test. And they're in all Maryland, DC, and Virginia, there is reporting for unsafe driving that's followed up with. Maryland and DC are self-reporting. So if you have certain conditions and you don't report them, that could impact if you do get an accident, insurance covering it. It could impact the type of ticket you get or what punishment might happen. With Maryland, they start mandating eyesight checks after age 40. And again, if your license expires in Maryland and DC, you might need to go in person to apply again. And there are a lot of resources out there for driver safety. So AAA, the American Association of Occupational Therapists, AARP, all have programs to help support safe driving. And I've listed them here. If somebody does need a driving evaluation, NRH has a great program that I've been to a couple times with clients. They're very kind. The process is a two-step process. So it starts with driving or just doing an assessment of somebody's reaction time, their cognition, their vision, and other issues that's just behind the desk with the therapist. And then the second appointment is behind the wheel, where the driving rehab specialist goes out with the person to do practice drives and sees how they do in real life situation. And they do report their results to motor vehicles. So that, unfortunately, this is all private pay. Insurance doesn't cover it, but that can be a way to really objectively assess someone's driving ability. And there are also other driving rehab organizations that offer that, but NRH is a big one in our area. And resources. So again, it's tough to replace driving. But there are ride shares, subsidized cabs, and at least in DC and Maryland, I don't work in Virginia, but that can help reduce the cost of cabs. And cabs are, all of them have wheelchair accessible vans in their fleet that are the same price. There's apps like Uber and Lyft, and there's one, I haven't used it in years, but GoGo Grandparent for people who don't have an iPhone or a smartphone. There's networks of friends, family, neighbors. In Montgomery County, there's JCA Connect a Ride. That is a great resource for helping to link people with driving resources. There's Metro Access, which is an application to apply, but if somebody can't drive and can't get to bus stops, that might be an option. There's senior villages that a lot of the senior villages offer volunteer transportation. Here in Montgomery County, we have Senior Connection, which is all volunteer, where you can have drivers take seniors for shopping or medical appointments. There's services like Neighbor Force or home care agencies or private duty aides that can drive folks. So a lot of people, it depends on the aid, but they don't know that if they need an aid for personal care, that aid might be able to drive their car or the older adult's car to get to appointments.